Ever since COVID, hygiene has become an incredibly challenging aspect of owning a dental practice. Before COVID, the hygiene model kind of worked. Pay for hygienists was high, but practices could still turn a profit. However, COVID completely disrupted the hygiene-driven model, especially on the West Coast. For the first time in my career, I let a hygienist go because it made more sense financially to not see hygiene patients than to keep them on staff. That realization was shocking. The traditional hygiene model, where hygienists operate independently and patients primarily flow through hygiene, needs to change. The question is, should the hygiene-driven model die, or can it evolve into something that works in today's dental landscape? So what is the hygiene-driven model? When I talk about the hygiene-driven model, here's what I mean. It's a model that emphasizes the hygiene department as the cornerstone of the practice. New patients are funneled through hygiene first, and the growth of the hygiene department is seen as a precursor to the growth of the doctor's side of the practice. This model assumes that if you grow hygiene, the rest of the practice will naturally follow. While this model has worked in the past, we're now at a point where the financials just don't add up. If the core of your practice is unprofitable, you can't sustain growth. Margins in dentistry have tightened to the point where we can no longer afford an unprofitable core. So we have two options. The first, scrap the hygiene model entirely and transition to a new need-based or new patient-focused model. Then there's revamp the hygiene-driven model to make it profitable again. Let's explore both options in detail. So option one, revamp the hygiene-driven model. If we're going to keep the hygiene-driven model, we need to rethink how it operates. The old metrics are no longer attainable using the same hygiene rules. For example, the traditional 3-to-1 ratio where the hygiene department produces 3 times the salaries of the hygienist is now far out of reach for most. If we were to use ideals and imagine what a truly profitable hygiene model would consist of, we would really need more like a 4-to-1 ratio to help offset the increased supply cost, front office labor costs, and the increased taxes. Now, here are some challenges in achieving profitability. We have high hygienist salaries. On the West Coast, hygienists are earning around $60 an hour plus. When you factor in benefits, payroll taxes, and other expenses, the true cost to the business of employing a hygienist is closer to $70 an hour. Then there are additional labor costs. The hygiene department doesn't operate in isolation. It requires significant support from the front office and other staff, further inflating costs required to make hygiene appointments happen. Then you have facility usage. Hygiene just takes up a lot of valuable chair time and space. If those chairs aren't generating enough revenue, you're losing money. Each hygiene chair required costs money for rent, utilities, equipment, and more. Now, there are some strategies to revamp hygiene, and one of the common ones is assisted hygiene. This is pairing hygienists with assistants, and it can increase efficiency. 1-hour appointments focused on prophies, perio maintenance, and x-rays become more financially viable when hygienists work with assistants. Problem is that if you switch someone to assisted hygiene, they are likely going to want to raise, which kind of defeats the purpose. To fully implement this, you may be required to hire someone that has that expectation going into it, which is not easy. Then you can adjust appointment times. Standard 1-hour appointments no longer work for every scenario. For example, prophies or perio maintenance without x-rays should probably be 30 to 45 minutes. Appointments with x-rays can remain closer to an hour if you have fees that are good. If fees are not that great, then these might also need to be 45 minutes. Shorter appointment times allow for more patients and bring costs a little bit more in line, but if you have several hygienists, this can make it harder to get to all the extra exams. So then we have some hybrid models where we combine both approaches. You create 2 types of hygiene appointments. You have assisted hygiene for routine visits and standalone hygienists for more complex cases, SRP, new patient exams. But times are reduced from the traditional 1-hour appointments. These changes are not simple, but they are necessary to bring hygiene back to profitability. They will also be a lot easier than changing your model. Now, back to the second option, which is transition to a need-based model. This option is to move away from a hygiene-driven model altogether and focus on a need-based or a new patient-driven approach. This model treats hygiene as an afterthought rather than the centerpiece of the practice. Instead of focusing on a whole hygiene department, you will be focused on maximizing the number of new and ER patients coming through your doors. In a need-based model, the primary goal is to diagnose and treat patients comprehensively. Hygiene becomes secondary to providing treatment. Patients are seen, diagnosed, and treated based on their immediate needs, with hygiene offered as a follow-up service. Now, why this model works so well? It's the focus on high-value treatments. Treatment has a much higher margin than hygiene procedures. It makes sense that a business that's focused on more on the higher value procedures would do better. By prioritizing comprehensive exams and treatments, you're increasing production without relying on hygiene to produce and find a work shown. Now, one thing that has been really difficult is overcoming the hygienist shortage. In many areas, it's easier to find new graduate dentists than hygienists. A need-based model leverages leverages the ability of doctors to perform hygiene tasks when necessary. This model is much more lean and efficient. This option minimizes the overhead associated with a full hygiene department, focusing your energies on what generates the most revenue. Now, there are challenges with the need-based model. Patients that are accustomed to traditional hygiene may resist the change. Finding doctors willing to take on hygiene tasks can also be very difficult. The current reality is that right now, many practices are caught between these two models. The traditional hygiene-driven model is unsustainable, but transitioning to a need-based model requires huge changes in marketing, scheduling, and patient communication. What you need to do partly depends on how dire your situation is. You first need to figure out how bad things are. Then run the numbers in your hygiene department. If it's operating at a loss, drastic changes are necessary. With hygienists in short supply and expensive to hire, consider whether it's easier to focus on hiring additional doctors instead. If you transition to a need-based model, you'll need to figure out how to educate your patients in a way to help them accept the new way you are functioning. The hygiene model, as we've known it, is no longer sustainable for many practices. Whether you choose to revamp your hygiene department or transition to a need-based model, the key is to act now. Ignoring the problem will only erode your profits and increase your stress. If you're facing similar challenges, or if you found strategies that have worked really well, share your thoughts in the comments below. Let's work together to make dentistry more fun, rewarding, and fulfilling. Don't forget to subscribe and stay tuned for more.